Kokong Ampri Lingdo MLA kaseng Congress benta kasi kat South Tarik Ujamang kalapen pau bamenta klade kapor babaro kide banyami shakamat banya trailang na kabenta banya khuni kani ka klam COVID-19.
This is the time communities have to get together. You cannot depend on just the darbars alone at this point of time because too many crises are occurring everywhere. We are willing to volunteer. Will the government call us to volunteer? I think that what is required at this point of time is a movement of individuals with a conscience. If people are not responding to the seriousness of the situation, get people like us who are willing to volunteer. We're willing to volunteer to tell people, please, if you have no business to being on the road, do not come to the road. But the point here is that this morning again in civil hospital, the magistrate did call for assistance from the police, the Sadar PS. But when the police personnel arrived, they just stood and they just stared at everybody passing by. No immediate training has been given to these groups of individuals. So I think there should be an immediate online exposure of some sort of a training to all police personnel. That when you go and assist at the time of a pandemic like this, you're expected to do these duties. Okay, so that is also not happening. I'm told that even in Negrams, where now the government is saying will be the only critical COVID center, I'm told that there are insufficient doctors. There are many doctors or doctor students who have passed 3rd year, 4th year, 5th year medical who have come back home. Why don't you call them to be your volunteers? Many individuals will be willing to sacrifice, but anyone who volunteers needs first to be protected. So give them the vaccine first. If that is the incentive you give individuals, I'm telling you, too many people will line up to help the government. Because right now, the most critical place is East Khasi Hills, particularly Shillong City. We are being hit in a big way. Out of all the deaths you see, it's always 70% which are from our district, from Shillong City. Look at the positive cases. I've been studying this closely. I'm told that doctors, even if you hire them, if you don't give them some sort of a training to utilize a ventilator, may not be actually of any assistance to the hospital. Because trained individuals to operate ventilators, trained individuals to help government for random testing. Imagine these 672 cases today do not include random testing. They were all they were all individuals who were at high risk contact. So imagine what's going to happen if government again begins, the random testing. At this point of time, you cannot look at anything else. And if you have to save as a government, those of us that can afford to pay for our vaccinations, let us pay so that you will buy more and you will give those others who cannot afford it. That should be the policy. Many citizens of the state are willing to contribute to pay for the vaccine. We're willing. So you just have to start cracking. You just have to start cracking. And it is not about Government of India any longer. Because Government of India has already washed their hands. They have told states, we leave it up to your wisdom. So states should be proactive. But again, I reiterate that we are grateful to all the health workers, the doctors, the officials of the government of Meghalaya who stand on duty every day during this period of crisis. We do not say that we disregard their contributions. But we are saying that maybe you do not have enough manpower to handle a crisis situation like this. Today in civil, if only they had some volunteers to help maintain social distancing amongst those who have come for the vaccination, There was no social distancing at all. Even inside the hall where my son was getting vaccinated, there was no social distancing. High probability that anyone could actually be asymptomatic and be a carrier, but unfortunately, we are not prepared. And we need to start acting. We need to put our foot down. We need to start delivering. These numbers have to immediately be arrested. You cannot have every day you're saying Meghalaya's new high, Meghalaya's new high, Meghalaya's new high. This new high now has become shocking and more shocking and very shocking. So if government needs help, call for a Zoom meeting. Let us all unitedly put our heads together. Put our heads together. If opposition, government, bureaucracy, health department, plus volunteers from Scouts and Guides and Red Cross come forward, nothing is impossible. We are a small population, we can still take care of our own, but we need to have out of the box ideas, and we need to get experts to help us design an approach. This is an epidemic. Get an expert. There are enough experts in this country who can help us at this point of time. You cannot expect an IAS officer to also be an expert in dealing with epidemics. You cannot expect a medical person to also be a doctor and then to also look at all of these other duties.